right, good morning. Good morning. Good morning to you and good morning to our live streamers. This is the University of Georgia College of Public Health's information session. We're calling it our Procrastinators Workshop because our application cycle is still open for the fall of 2015. We will be accepting applications through July 1 on a space available basis, so we are doing rolling admissions. And so this workshop is just to give you a very brief, a very bridged version of what our MPH program looks like, what the College of Public Health is, what the admissions process is, for those of you who have not started the admissions process. And if you have any specific questions, feel free to raise your hand at any moment. The live streamers, feel free to email or call me after this broadcast if you want to talk in specific about anything that I did not get to cover here. We will get started with our PowerPoint slides. So I'm going to disappear and then reappear shortly. There we go. All right, so the College of Public Health has many core faculty members, but a lot of administrators, staff members, support services as well. So in regards to student support, there are 3 key players in the MPH program. Oh, and I did forget to mention that I'm only going to be talking about the MPH today. We do offer several other degrees in the College of Public Health, and there will be a couple of slides detailing those, but today we're really only covering the 7 concentrations and certificates within the Masters of Public Health. So the key support services personnel for the MPH program, the main people that you would see through your MPH curriculum would be Nina Cleveland, who is the practice coordinator. She works with students on their internship. She works with students on career services. She has a seminar that she teaches every year that helps guide students with their CV, with their resume, helps with interviewing skills. She also works very closely with students on networking and sort of figuring out where they want to go next and how to get there. Lindsay Whitaker would be the person that you talk to before walking into the door. So she talks to all prospects about our program, the admission cycle. She holds your hand through the SOFAS and graduate school application. And as many of you know, it is a very tedious and complicated process. So Lindsay Whitaker is the support for that. And I am Limbi Okundai. I did not introduce myself when we started. And I am the MPH director. So the College of Public Health has its core mission as building promoting the health in human populations, protecting the environment, and preventing disease and injury in the state of Georgia is our core mission, but also in the United States and globally through innovative research, exemplary education, and engaged service. We started our College of Public Health in 2005. There were several departments that had been operating at the University of Georgia, but then merged in with the College of Public Health when it was created. We became accredited 3 years later by the Council on Education for Public Health and got our reaccreditation in 2014 for the next 7 years. So we are well on our way to maturing our MPH program and in maturing our other newer programs within the College of Public Health. But again, many of our departments, many of our faculty have been practicing and have been around for much longer than the College of Public Health's inception. We are celebrating our 10 years this year, and we are very excited to say that we are no longer the baby at the University of Georgia. The newest school at UGA, the engineering school, took over as the baby, and we are now the middle child, vying for all of the attention and the love that the university can give us. And we have been very tedious about making ourselves as unique as possible, not only for a college within the University of Georgia, but also as a public health program in the state and the region. Our projected enrollment for the College of Public Health is 900, which seems like a pretty big number, but of those 900, about 500 of them are undergraduate students. The other 300 are graduate students, with about 160 of those being MPH students. So the MPH program is our largest graduate program, but there are a ton of other programs that are included in that 900 count. And this is just a breakdown of the degrees that we offer at the College of Public Health. And I always like to include this slide, even if you know for sure that you want to be an MPH student, just to let you know that public health has a plethora of degrees, plethora of concentrations and specialties. And so this is a really important slide for others to see. Even if you do get the MPH and you decide that you want to go on to further your education and get a doctoral degree, these are some of the other degrees that we offer. The newest venture for many programs, especially with the economy the way that it is, and with many people graduating with college degrees and not being able to get jobs, the newest trend for many programs, and not just programs in public health, is to offer dual and joint degrees. It's sort of a way to get the most for your dollar spent. You get, a 2-for-1 basically. Our newest joint ventures are the Masters of Social Work and the Masters of Public Health. Our MD MPH program has been underway for several years. And the newest one that just started this past year is the MBA MPH. That's a collaboration with the Terry College of Business here at the University of Georgia. It is important to note that with the joint degrees, some of them do require that you are in a specific concentration. So if you're interested, for example, in the MBA MPH, that degree is only offered in the public health side through the Health Policy and Management department. So, just kind of knowing that it may be really, really important to you if you did have intentions of pursuing a joint degree, a dual degree. What we will be talking about today is what's right there on the left side of the screen, the MPH with 7 concentrations. We will go very, very quickly through the various concentrations just to give you an idea of what you may want to focus on when you come in to do your MPH. Some schools do permit applicants to apply for all of the concentrations that they offer. Unfortunately, here at UGA, we decided that we would rather students are really, really familiar with what they want to do before walking in the door. And so we require that applicants know which specific concentration that they wish to be reviewed under. We have environmental health, health promotion and behavior, health policy and management, epidemiology, biostatistics, and our newest 2 MPH concentrations starting last year are gerontology and disaster management. So there are several key things that make public health here at UGA very unique to other public health programs in the state and the region, and I'll just go very quickly over them. We have a local and state mission at the core of what we do. The University of Georgia is the first land-grant institution in the United States. And knowing that, and if you are from North Carolina, you may beg to differ, but I'm going to tell you that we are the first. So having said that, being a land-grant institution means that you put local and state as the mission, as your core, as your focus, as the thing that really drives not only your research, but your service, your outreach, your teaching. So having that important relationship, finessing and fostering the relationships with the community, relationships with organizations across the state and the region, gives our students opportunity to network with these organizations, to intern with people across the state and around the region, and to really get to know what we do in public health in the region. And of course, we also have a primary interest in educating students from this region. And so the applications process, though we do not favor in-state students in particular, we do make sure that we really do outreach and recruitment efforts in the state and the region in order to really help people who may be interested in receiving a public health degree in this area know that we are here specifically for you. We have very high quality faculty. Of our 62 faculty members, about 15% of them hold not only a specialist degree in a public health discipline, but also a medical degree. All 62 of our core faculty do have terminal degrees in some area related to public health, if not specifically public health. We have a very low student-faculty ratio. Because our MPH program stands at about 160 students and we have about 62 faculty members, we do have about a 20-to-1 faculty-student ratio. It can go down to 18 and even as low as 8-to-1 faculty-student ratio for some of our lower demand concentrations. That really allows students to have a very one-on-one, very personalized educational experience here at the College of Public Health versus larger institutions where you are one of 500 or one of 800 students. So being in a classroom where you have that more intimate interaction allows students to really engage not only with each other and help each other get educated and learn about each other's experiences, but also what faculty are doing out in the field, what they're interested in, what you may be interested in collaborating with faculty on. So having that lower student-faculty ratio is something that we are incredibly proud of. And even as we continue to grow, we will make sure that we maintain a lower faculty-student ratio in order to stay as unique as possible in this public health arena. We are very proud of our diversity. Over 35% of our student body come from underrepresented groups. About 7% of our student body are international students. Not only do these numbers rank higher than the university's average, but we are on par with the state averages for underrepresented groups. That means that our outreach efforts really do go out to who they need to go out to in regards to getting people to come in and receive a public health education who may not have had the opportunity or thought about it or have received any outreach from other institutions. Our affordability and our high graduation rates are something that we are also incredibly proud of. When you compare the cost of education to other public health institutions around the state, we are one of the most affordable options, especially given our ranking as a University of Georgia. We are at about $6,500 per semester for a full-time student for tuition. There's an additional cost for fees. I think it's about $1,200. And then about just under $400 for part-time students per credit hour. So we're talking about a really, really affordable public health education, especially given that our curriculum is meant to be done in two years or 4 academic semesters. When you add that up, you're really talking about a great deal compared to some of the other state institutions, and especially compared to our private counterparts around the state and the region. And of course, our high graduation rates are something that we're proud of, because once a student comes in the door, we do everything that we can to get them out and get them out on time. We are at about 89 to 92% of a graduation rate for the MPH incoming cohort within 2 years. So we're talking about faculty support, we're talking about academic and student support. So not only are we trying to foster your social and your outreach experience, but we're also trying to make sure that your academic experience is fruitful enough and that you do graduate within that 2 years with an MPH. We are an accredited institution, and it is important for students to know, for applicants at least, to know what it means to be an accredited institution. All public health institutions that are accredited by the Council on Education for Public Health, or CEF. Accredited schools or colleges are very different than accredited programs. Accredited schools and colleges are required to have the 5 core areas of public health within their curriculum. Those would be environmental health, behavioral science, biostatistics, epidemiology, and policy and management. Those 5 areas must be a part of the curriculum and must reside within a school or a college as a program, a department, or a unit in order for a school to be considered a school, public health school or college. Programs are those that are more focal in their discipline. So a public health program could be very much focused on, let's say, just global health, or just maternal and child health, or just community health and health education. So public health programs tend to be very central in their focus, while public health schools and colleges provide that more robust public health educational experience. Not to say that one is better than the other, but it is important, very important for applicants to know the differences between accredited schools and accredited programs. Accreditation also means that you are nationally recognized in the field of public health, that you and that your education is a competency-based education in all of the disciplines within the public health, but also all public health degrees. As accrediting agencies come in the door every 5 to 7 years and look at our books and look at our students and look at our faculty and everything that we're doing in terms of research generation, outreach, and student education, it is important that we stay ahead of the game. So we are constantly on our P's and Q's, making sure that we have a competency-based education that is wholesome and competitive with other accredited schools of public health. Also, being accredited means that students can seek funding opportunities that are very specific to CFR accredited institutions, and they can also seek to be credentialed as a CPH or a certified public health practitioner. Once they have taken the 5 core courses in public health, they can sit for the CPH exam via the National Board of Public Health Examiners. And just to talk very quickly about us, College of Public Health specifically, we have 4 departments, 5 academic units. We have 2 institutes and 1 center, and we offer 7 MPH concentrations. So that's a lot of numbers there. But our academic units are comprised of epidemiology and biostatistics residing in 1 department. And then there's environmental health sciences, health policy and management, and health promotion and behavior. And I will just go very quickly over what the different concentrations within MPH mean. So biostatistics, what do biostatisticians do? They collect, store, retrieve, analyze, and interpret health data. If you are very much a data-driven person, if you love statistics and math, if you love software, analytical software such as SAS, SAS, and SPSS, then biostatistics is the concentration for you. If you don't understand anything that I just said, or that makes you kind of nervous, then you do not want to do biostatistics. There are no set prerequisites for biostatistics, but they do require that students have a strong math background in their undergraduate career. So a background with calculus, linear algebra, statistics on your transcript, and having performed well in those courses is very highly encouraged, as well as performing well on the quantitative part of the GRE. Epidemiologists study the distribution and frequency of disease to determine to figure out the determinants of health, disability, and death in human populations. So whereas biostatisticians look at the numbers and figure out how to create and analyze the data, epidemiologists try to figure out how to hypothesize what's going on and then how we're going to execute the research in order to prove or disprove a hypothesis. So how do we figure out more about determinants of health via the studies that we are performing within public health, and how does that information then translate into improving public health as a field and the health of the population? That is what epidemiologists do. If you are not at all interested in doing research, learning how to conduct a survey, learning how to build a survey, learning how to implement a study, not conduct a survey, conduct a study, learning how to build and conduct a study, and learning how to implement the study, and then further analyzing and interpreting that information and what it means to the health of the population, then epidemiology is not the concentration for you. If you are interested in those things, then this is definitely where you want to be. Some areas of interest for our faculty within biostatistics and epidemiology, and these guys work very, very closely together because you can't have one without the other, right? You can't have the biostatisticians just throw the data out there without having someone to interpret it, and vice versa, correct? So these guys work very closely together, and these are just some of the key areas or key focus of their research within that department. Environmental health science is our next concentration. It is the study of the impact of the environment on the health of humans and other species. And as David A. Schwartz, the former director for the National Institutes of Health Environmental Services Division, stated, almost every complex disease from diabetes to obesity, heart disease, and many cancers is in part caused by exposures from the environment. Environmental health science is the bench science of public health, focusing very, very heavily on the hard sciences. If you have no interest in biology, chemistry, microbiology, for example, this would not be the concentration for you. They do have specific prerequisites in those courses on your academic transcript, and you're required to have excelled and performed well academically in biology, chemistry, and or organic chemistry. Some of the areas for environmental health sciences research, it is very interdisciplinary degree, so you work on environmental chemistry, environmental epidemiology, genomics, microbiology. Our toxicology area within that department is very strong. They offer 2 degrees for toxicology specifically. So there are a lot of very amazing research interests within that department. Next is the Department of Health Promotion and Behavior. We are very quickly, in the last 150 years, we are moving from dealing with determinants of health in a very preventive way in regards to infectious disease prevention, improving sanitation, for example, improving environmental conditions, or was the way to improve the population level health 100 years ago, but now we're looking more towards behavioral health, right? The things that we do negatively impacting our health, smoking, risky sexual behavior, what we eat, how many times we exercise, those things are what are detrimentally affecting the health of our population. So health promotion and behavior has really come at the forefront in public health to really deal with these behavioral change topics and how we influence and try to positively affect change in a population by influencing people to change their behavior. Some of the areas of faculty research in health promotion and behavior include worksite health promotion, school violence, HIV and cancer prevention, traffic safety and injury prevention, excuse me. Health policy and management is our next concentration. If you are at all concerned about the skyrocketing cost of healthcare, the unsustaining and potentially detrimental effects of the increase in cost and care, then health policy and management is where you want to be. Health policy and management focuses a lot on the quality of healthcare, the management of healthcare organizations, financing and insurance. If you're trying to wonder why we spend 18% of our GDP on healthcare and health-related costs, but yet we are not seeing those positive health outcomes that other countries see but spend less on, then this is definitely the area that you want to be in. And really, there's no area in public health that is not ultimately affected by policy, that is not ultimately influenced by policy, because what drives our regulations and our enforcement in public health are our policies and the way that we managed our public health infrastructures. So this concentration is a very key and core concentration within the field of public health. Our faculty research areas include health economics, pharmaceutical economics, tobacco use and control, health consumerism, health outcomes, program and economic evaluation, etc. Disaster management. The Institute for Disaster Management is a team of internationally recognized experts in fields such as emergency management, weapons of mass destruction, disaster modeling, and public health. Our disaster management faculty are very instrumental in the accreditation of hospitals and clinics around the state. They work with them on their emergency plans, and so they are constantly out in the field. If you are of that personality that likes to be out doing hands-on work, doing really important work in regards to just stopping and not necessarily preventing, but dealing with the aftermath of natural and human-made disasters, then this concentration is definitely where you want to be. They also provide a lot of certifications throughout the MPH, so when you graduate with disaster management MPH, you are also very highly certified in other in dealing with, you have certifications within the field that make you very competitive as an applicant. Gerontology is dedicated to finding solutions to the challenges of an aging society and serving the needs of all Georgians. The Gerontology MPH not only focuses on the 55 and over population, but they also really do heavily focus on the lifespan. Because when you are a child, you will ultimately get older and you ultimately become an aging person, and all the things that you do throughout your lifespan really do guide how you are as an older individual. So they really do look at the lifespan in gerontology. They like to focus very specifically on issues that can improve people's health once they age, but also preventive things that people can do so that they are in better health once they age. And additionally, the services and the infrastructure that is needed in order to effectively work with an increasingly aging population. Because globally, we are seeing people who live much longer, but also as a proportion of the population, our aging population is becoming a much larger of the proportion versus our working age and dependent populations. Did you have any questions? I kind of saw your hand go up a little. You good? Okay. All right, so in addition to our 7 concentrations, which I know I went through really, really quickly, we do have some certificates within public health. We have 3 that we focus on: global health, the certificate in global health, certificate in gerontology, and certificate in disaster management are also offered in conjunction with or alongside the MPH. These certificates are not meant to keep you here longer than you need to be. If you are here for 2 years, you can get a certificate or even 2 certificates within those 2 years. You have to really work with your advisor to finesse your curriculum to make sure that you are on par to graduate with the certificate as well as the MPH with the level of coursework that you need. It is 18 semester hours of eligible coursework for each of these certificates. Many of those courses can also count towards elective hours on your MPH curriculum, and that permits you to get really specialized in a very particular area while not, again, staying on longer than you need to. The certificates can be taken alongside an MPH, or you can come in as a non-degree seeking student and pick up a certificate without having to pick up an MPH at all. Just very quickly, the MPH curriculum consists of 5 core courses, 3 credit hours each of these courses to round out 15 credit hours in the 5 key areas: behavioral science, biostat, environmental health, EPI, and health policy and management. Additionally, you take 3 or more courses depending on your concentration that are specific to your concentration area. And then you add a series of electives, usually 2 to 3 courses of electives in order to round out that core curriculum. And those electives really allow you to specialize. Like if you're doing a certificate in global health, for example, those elective hours could be in global health specific courses so that you're really specializing in a very specific discipline within the field. There's a 1-hour seminar that is required. It's every spring semester. You sit and you listen to practitioners, researchers, and faculty members talk about the things that they're doing out in public health. The seminar is also a really wonderful opportunity for students to network. To round off the MPH curriculum, there's a 6 credit hour internship. It is 300 contact hours within a semester, 1 semester only. You can do it in spring, summer, or fall. Depending on the concentration, you either do your internship towards the middle of your program, or you have to wait until the tail end of your program once you've acquired all of the skills necessary to go out into the field and actually practice. The internship is a really wonderful opportunity to, again, network with practitioners out in the field so that you're better aligned to really start applying for careers and receive the support and services that you need to achieve gainful employment. To round off the MPH completely, in the very last semester of your MPH, you do your capstone project. The capstone project can take up many forms. It can be a public health culminating project where you pick a topic, and then you encompass all of the 5 areas of public health in order to address that particular topic and how that topic impacts the health of the population. You can do a publishable article. A lot of faculty are now pushing students actually to do the publishable article route because it's very meaningful on a resume or CV to have a publishable article under your belt. The caveat to a publishable article is that you have to start really early working with a faculty member. So you cannot wait until the last semester of your program to then say, I want to do a publishable article. It is highly recommended that students do directed studies, independent studies, even research assistantships to really gain the experience that they need so that once they get to the capstone project, they have worked diligently throughout their 2 years and can get a publishable article out the door. As anybody who's ever done a publishable article or thought about doing one and looked up what it takes, it can take several months or even up to a year or longer to get a publishable article out the door. The other option is a thesis that would look very much like an MS program where you pick a particular topic and you in essence try to become an expert in that very specific thing. But the thesis option is definitely there as a capstone project. Again, you do the capstone at the very, very end to round off your 45 credit hour MPH curriculum. There are several international opportunities, and I'd love to put this slide up because I know that a lot of students are not only interested in global health, but are interested in global health experiences while they're doing their MPH. And there's no better time to really get out there and see the world as when you're in grad school. Okay, so our faculty members not only have ongoing research and service collaborations in these areas, but a lot of our faculty teach courses in these areas either during the summer or even some in the fall and spring. We have faculty doing research for reproductive health and indoor air quality in Peru. We've got traffic safety studies going on in Croatia. There's HIV, AIDS, and tuberculosis prevention research ongoing in Uganda. We've got a lot of students that go every summer to Israel and work with researchers and professors at the University of Haifa on their public health infrastructure, because Israel has one of the strongest public health infrastructures in the world. So our students really do get to kind of see what it's like to really have the push and the resources to have a strong public health infrastructure. So those are just some of the international opportunities. And I would be remiss if I did not put a plug in for our students and what they do for each other. Our Public Health Student Association is a wonderful group of students who really do get the students together to do social activities, to do a lot of community service outreach, a lot of philanthropic work. But our Public Health Association, with their funding, also supports students in doing academic endeavors, such as presenting at conferences or paying registration fees for conferences that they really want to go to. They get a group of students together every year to attend the annual Public Health Association conference that happens. This year, I believe it's going to be in Chicago. This past year, it was in New Orleans, Louisiana, so that was a great time. But this is just to say that our Public Health Association really does get the students together to do not only just wonderful social things, but also really wonderful philanthropic and academically strong things. And then just very, very quickly, I know we only have a couple of more minutes, to fund your education. This is a very, very tedious part of applying to the MPH program, how you're going to pay for it. So in addition to the loans and these other things, trying to get your parents to pay and all these other things, it is really encouraged that if you are academically strong, a lot of graduate research, teaching, and general assistantships are based on merit, not necessarily financial need, though a lot of schools do take into consideration financial need. A lot of these things, because they are very limited in numbers, are based on merit. If you're academically strong, it is encouraged that you try to apply early to these graduate programs, or that you would try to look at the funding opportunities that are available at a college or departmental level very early in the admission cycle, because these things get taken up very, very fast. You have to be a full-time student to receive these sorts of funding. And you have to really be diligent in getting the funding. Even if you don't get an assistantship when you're walking in the door, if you know that you've taken biology or chemistry classes, you can apply to be a graduate assistant in that area once you're an MPH student. So it doesn't mean that the doors have closed for you once you come in the door. It just takes a lot of diligence to try to find funding once you're here. Scholarships are out there, but you have to apply really early for scholarships. It takes a lot of forethought in order to get scholarships. Most scholarships, external ones, especially national scholarships, their cycles open around September through November, and they're usually for funding for the following year. So you're talking about really, if you're trying to find some funding for January, for example, you have to start at around July looking at the applications and then really start applying for them looking at the nomination process and the interview process around September and November, through November. And then searching for funding, I like to put this in as a plug, is very much like looking for a job. You have to be very diligent, very persistent. You have to knock on faculty members' doors. You have to really know that what you want to do in terms of research or teaching strongly aligns with what your background and experiences are. So you have to really do some introspective sort of reflection and really understand that the things that you could bring to a table for graduate research or teaching assistantship, or even for merit or need-based scholarship, a lot of times based on your abilities and your background. So very much look at it like applying for a job. These are just some of the titles that our public health graduates go into the workforce as: a public health management analyst, health communication specialist, research scientists, epidemiologists, managers of public health prevention programs, program managers, data evaluators, and specialists, etc. And then these are the top employers in public health. The Centers for Disease Control and Prevention, of course, is a big one, the National Institutes of Health as well. There are federal public health arms. So of course they're going to be huge. State and local, and even the National Department of Public Health are big parts of employers in public health. Every state, every community has to have a public health department, and those public health departments are integral in the data that they collect, in the programs that they implement, and all of the things that they do in order to improve the health of the communities. So state and local public health organizations are very instrumental in employing our public health, our MPH graduates in particular. Academia, of course, is a big one. A lot of our students not only go into research in academia, but also go on to furthering their education. So that's a huge chunk of where our MPH students go. And then, of course, hospitals and medical facilities, local and state nonprofits and corporations are a big part of where our graduates go. And these are just the ranges according to the U.S. Census Bureau, Department of Labor Statistics. These are the ranges of public health careers, the salary ranges, excuse me. The lower end tends to be the bachelor's degree students. A lot of public health bachelor students go straight out into the field. So that lower end of $30,000 level range is what you're looking at. In the mid-range tends to be where our MPHers lie. And then that higher range is if you have a ton of experience or are graduating with a terminal degree. And then this is just a screenshot of our recent graduates and where they've gone. Of our 76 MPH graduates from the spring of 2014, 60% went on to be full-time employed, and then another 19% are attending graduate school. Another 8% are either at an internship or employed part-time, and just 13% were still seeking employment. So of the 83% respondents that responded to the survey of those graduates, we have a really, really high placement rate. The Association for Schools and Programs of Public Health, ASPPH, likes to see an 80% placement rate or above for all MPH programs in the nation, and we are among the top for our students going on for employment, with just 87% of our students going, not just, more, as much as 80% of our students going on and getting gainfully employed. Now we will do a quick admissions session with Lindsay, and I do thank you for listening to that rather fast presentation on our program.
Hi, my name is Lindsay Whitaker. Hold on just 1 second. Let me share this with you. All right, and I'm going to give a brief presentation about the admissions process, about the application process to apply for the MPH program. So we don't have minimum requirements, but we do have minimum recommendations. We recommend that everyone has in the 60th percentile for the GRE in each section, in both the verbal and quantitative section, as well as a 4.0 on the analytical scale, or score, excuse me. As far as GPA, we recommend on a 4.0 scale that you have a 3.0 GPA or higher in order to be competitive. We do require 3 letters of recommendation, your resume, statement of purpose, of course, and it is a 2-step application process. So you actually do have to fill out 2 completely separate applications in order to complete the MPH application process. So the first application is to the graduate school. This application is more or less just to get you into the UGA student records system. So you have to complete your basic information. It's online only, but we don't require any additional forms. So you don't have to submit your transcripts to UGA until after you have been admitted. You don't have to submit recommendation letters. You don't have to submit your GRE to UGA. We can get that from your SOFIS application. And there is a separate application fee for the graduate school, which is $75 for domestic applicants and $100 for international. Part of the graduate school application is an online electronic form for recommendation letters. So you do have to submit someone's email address in that field in order to advance past that part of the application. Because no faculty member is actually going to see your graduate school application, you can just put your own email address or a dummy email address or something and just ignore it, because your actual application that's going to be reviewed is the SOFIS application. We are still reviewing and receiving applications for this fall. The graduate school does have a deadline of July 1st, however, so if you want to be considered for this fall, be sure that you complete the UGA application by that deadline. Now, the application that the faculty members are actually going to review when they are considering you for admission is your SOFIS application. You can create your account, you can log in and out as many times as you want. You don't have to do it all in one sitting. So don't feel like you have to block off a whole 4 hours to do it all at one time. You can take your time with it. There are 3 letters of recommendation that we require. Make sure you talk to your recommenders ahead of time. We want someone that's going to be able to write a strong letter of recommendation. We'd like to see at least 2 from professors. Faculty really like to see how you are as a student in the classroom, so those are always really important. These are also going to be electronic letters of recommendation, so you'll need a current email address for the faculty or whoever's writing your letter, and make sure they are aware that they are going to get a generated email with a link to do the electronic form. You also want to send your GRE scores to SOFIS. The code 8345 will get them there, and then you do have to send your transcripts to SOFIS. Any coursework you have ever completed, you have to send. So if you went transient as a summer, maybe forgot about it, or it's been so long since you've been in high school you forgot you did dual enrollment, they won't actually verify your coursework and make your application available for us to review until they have received all of your transcripts. So once they receive your transcripts, they verify the coursework. That can take anywhere from 2 to 4 weeks, depending on how busy they are in their admission cycle. And then once your coursework is verified, your letters of recommendation in, your GRE is here, and your completed graduate school is here, completed graduate school application is here, then we can send your application to the faculty to review. But we can only review complete applications. So as you're applying, make sure you're utilizing that status check on the SOFIS application to make sure that things are actually being received. If transcripts are missing, contact the school to make sure that they actually sent the transcript. Sometimes things happen and they don't get sent. If it's a letter of recommendation, contact your recommender. If you have questions and you're not really sure why you're incomplete, just give me a call, email me. I'm happy to help facilitate that process. For anyone interested in applying for 2016 or beyond, the application deadlines, the early deadline is January 5th, and as Mumby mentioned earlier, it's really important to meet those early deadlines if you want to be considered for the assistantships, especially ones we have in the college. And then April 1st is our deadline for the regular application, and then we'll continue accepting applications after that date pending space availability within the college. All right, so here's my information as well as Mumby's. You can email me at my direct email address, which is online, just my first name, the letter T at UGA, or you can email me at mph@uga.edu. That's a little bit easier to remember. If you have any questions, again, throughout the admission cycle, any application questions, any SOFIS questions, just give me a call or email me. And then any program questions, just give Mumby a call or email. Right.
We would like to thank you for the live stream. If you are still out there, thank you for participating and have a wonderful afternoon, and thank you for coming. And we will have a breakout session where you can go and speak with faculty members. And for you guys online, if you would like any information, if I went too fast, if you need Lindsay to help you with your SOFIS application, whatever you may need, please feel free to contact us. Thank you and have a wonderful afternoon.